Hello, this is Dr. Emma Head-Nichols, and this is the latest U.S. FDA approvals for the week of April 1st through the 5th, 2024. First up this week, we got the FDA has approved ciltacabtagene autoleucel, also known as Carvykti, Cilta-cel, for the treatment of adult patients with relapsed or refractory multiple myeloma who have received at least one prior line of therapy, including a proteasome inhibitor and an immunomodulatory agent, IMiD, and who are refractory to lenalidomide. This is the latest approval for Cilta-cel, which is a CAR T-cell therapy approved in 2022. CAR T-cell therapy involves genetically modifying a patient's T-cells to express chimeric antigen receptors that specifically target cancer cells. The approval of Cilta-cel was based on findings from the phase 3 CARTITUDE-4 study. In the study, Cilta-cel significantly reduced the risk of disease progression or death by 59% compared to standard care regimens in patients with relapsed and lenalidomide refractory multiple myeloma who previously received 1 to 3 lines of therapy. The median progression-free survival was not yet reached with Cilta-cel compared to 11.8 months with standard regimens. The approval of Cilta-cel was granted to Johnson & Johnson. Also this week, the FDA has approved Fam-trastuzumab, deruxtecan-nxki, also known as Enhertu, for adult patients with any unresectable or metastatic HER2-positive IHC3+ solid tumors who have received prior systemic treatment and have no satisfactory alternative treatment options. Enhertu, first approved in 2019, is a conjugate of an anti-HER2 antibody and a cytotoxic drug, which allows for the targeted delivery of chemotherapy for HER2-expressing cancer cells, potentially limiting damage to normal tissues. HER2-positive solid tumors, which overexpress the HER2 protein, are often more aggressive and more likely to recur than HER2-negative cancers. The tumor-agnostic approval was based on the results from 3 multi-center trials, DESTINY-PanTumor02, DESTINY-Lung01, and DESTINY-CRC02. The approval of Enhertu is granted to Daiichi Sankyo Inc. under accelerated conditions with the stipulation that continued approval may depend on the results of confirmatory trials. Also this week, the FDA has approved Iloperidone for the acute treatment of manic or mixed episodes associated with bipolar I disorder in adults. This marks a new indication for Iloperidone, which was previously approved in 2009 for the treatment of schizophrenia in adults. Iloperidone is an atypical antipsychotic that modulates neurotransmitter activity in the brain, primarily targeting dopamine and serotonin receptors. Bipolar I disorder is characterized by manic episodes which last at least a week and can be severe enough to require hospitalization. During these episodes, individuals experience elevated mood, increased activity, and other symptoms such as inflated self-esteem and decreased need for sleep. The approval was based on a pivotal study involving 400 patients, which demonstrated that Iloperidone was effective in managing manic or mixed episodes. In the study, Iloperidone-treated patients showed significant improvement compared to placebo by week 4 of the study. The approval of Iloperidone was granted to Vanda Pharmaceuticals. And now a word from the supporter of this podcast, Nascent Medical. Is your company in need of medical writing assistance? Visit nascentmc.com. That's nascentmc.com. Our native English-speaking MD and PhD level medical writers create fast turnaround needs assessments, medical news pieces, manuscripts, slide decks, ad board summaries, and much, much more, all for the price of a single freelancer, but with a much wider selection and with a background in the specialty that you need. Nascent Medical, we're here so that you never have to be without excellent medical writing help. Also this week, the FDA has approved ceftobiprole metocarol sodium, also known as Zevtera, for the treatment of adults with Staphylococcus aureus bloodstream infections, bacteremia, including those with right-sided infective endocarditis and acute bacterial skin and structure infections, ABSSSI. Additionally, Zevtera is approved for the treatment of community-acquired bacterial pneumonia, CABP, in both adult and pediatric patients aged 3 months to less than 18 years. Zevtera is a broad-spectrum cephalosporin antibiotic that exhibits activity against a wide range of gram-positive and gram-negative bacteria, including MRSA, and it functions by binding to and inhibiting penicillin-binding proteins, which are essential for bacterial cell wall synthesis. The approval of Zevtera was granted to Basilea Pharmaceutica International Limited. Also this week, the FDA approved the TriClip transcatheter edge-to-edge repair. It's also called the TEER system, TriClip, for the treatment of tricuspid regurgitation. The approval introduces a minimally invasive treatment option for patients who require tricuspid valve repair but are not suitable candidates for surgery. The mechanism of action for TriClip involves clipping together a portion of the leaflets of the tricuspid valve to enhance valve function and facilitate proper blood flow, thereby eliminating the need for open heart surgery. Tricuspid regurgitation is a condition where the tricuspid valve fails to close tightly, allowing blood to flow backward in the heart. This can strain the heart, leading to symptoms such as fatigue and shortness of breath, and can progress to more severe conditions such as atrial fibrillation and heart failure. The FDA's approval is based on findings from the TRILUMINATE Pivotal trial, which demonstrated significant improvements in the severity of tricuspid regurgitation within 30 days, a benefit that persisted at least 1 year. The approval of TriClip was granted to the manufacturer Abbott. Also this week, the FDA granted priority review for revumenib, also known as SNDX-5613, for the treatment of adult and pediatric patients with relapsed or refractory acute leukemia harboring KMT2A rearrangements. This is the first regulatory filing for revumenib as a new therapeutic agent. Revumenib is a menin inhibitor which disrupts the interaction between the menin protein and mixed lineage leukemia MLL proteins involving leukemic transformation. Acute leukemia with KMT2A rearrangements is a subtype of acute leukemia, which is associated with poor prognosis and high relapse rates. This agent is being studied in the pivotal phase 1/2 Augment 101 trial. Revumenib is manufactured by Syndax Pharmaceuticals. The PDUFA action date is set for September 26, 2024. All right, that's it for this week. Please visit LacedMC.com if we can assist with any medical writing needs. And also, if you are a medical editor or writer, please do visit learnamastyle.com. We have a free course on ChatGPT-4 and then several downloads, including a list of prompts for medical writers. And I hope that you'll tell your colleagues about this podcast as we try to grow the audience and serve more people with this latest information on FDA approvals. Have a great week.